I'd like to begin with a personal story. And the story is about two boys who were growing up in Easton, Connecticut. It's a small town where I was raising my family. The year is 2004, and both boys were in high school. The first, Mikey, was diagnosed with cancer. As you'd expect, his family was devastated. However, they were easily able to access the highest quality medical care, all based on science. Our entire community rallied behind Mikey and his family. Parents came to their home with cooked meals, drove carpools. The kids and the teenagers in our community held bake sales on the weekends. And the whole time Mikey was sick, he received all the love and compassion that anyone with a disease could ever dream of. Well, 2 streets away, Mikey's friend, my son Brian, was also struggling with the disease. But for Brian and our family, it was very different. We looked for medical care for our son, and we couldn't find any that was based on science. Our community didn't rally behind us. No cooked meals, no carpools, no bake sales. But most importantly, when Mikey came home to visit, he felt a welcoming community. When my son came home to visit, he felt silence and contempt. The disease my son struggled with was addiction. Over the next 8 years, we tried really hard to figure out a confusing web of treatment programs for my son. And Brian tried so hard. However, on October 20th, 2011, I was woken up in the middle of the night and told that my son had just died. He was 25 years old, and he hadn't used a substance in 13 months. Equally tragic, it wasn't just addiction that took my son's life. It was the feeling of shame he had every morning when he opened his eyes, of all day long feeling like an outcast, that caused him to wake up that morning, research suicide notes, write a note of his own, and take his own life. Alone. Why are these stories so vastly different? Mikey was a patient. Brian was an outcast. Well, in the weeks that followed Brian's death, I began to focus on 2 questions. What could I have done differently as a father? And what could be done to spare other families of the tragedy that our family had suffered? I took what I thought would be 3 months away from my business and traveled the country. And what I learned destroyed me even worse. I learned that proven research about the prevention, treatment, and recovery of addiction was sitting there, completed, randomly controlled trials, buried in medical journals, and not being implemented. Information that could have saved my son's life and literally millions of others. But what came from this was a vision. A vision of a well-funded national nonprofit run like a business that would engage society to ensure that the proven research that could help people was implemented to protect our families. And from this, our organization, Shatterproof, was launched 9 years ago. As I stand here in front of you right now, I miss my son horribly. However, in many respects, I also feel blessed. I've had the opportunity to meet so many wonderful people across our country, hundreds of thousands, and together we have been making that original vision a reality and helping so many. Through our leadership, 27 state policies and two critical components of federal legislation have been signed into law that is already helping and saving thousands of lives each and every year. We documented for the first time in our nation's history one national standard of care for the treatment of addiction that's all based on science. Unbelievably, it hadn't existed. We developed for the first time in our nation's history, a quality measurement system, essentially a consumer guide to treatment, so families looking for treatment can easily locate treatment programs that were delivering science-based care. It's expanding. It's been so well received, it's expanding across the country rapidly. And early next year, we'll be in states representing 45% of the families in the United States. We developed a program to reduce stigma. The way that the public feels about those with this disease, and piloted it last year. It was so successful. We reached 4 million people who changed their views about those with this disease by 38% across a series of measures. It's now expanding into 5 states, representing 22% of the United States population. We've done a lot together, but we can do more. And I'm here to say that we must do more. We've built the infrastructure. We spent 9 years building the infrastructure, building these programs, and now it's about scale. It's about scaling these programs across the country so every family has access to them. So I'm here to ask for your help. For any of you, each of you, who may have an interest in learning more about what we're doing or getting involved in any way, you can reach me through the app, the SALT app. I'm on there. Just search for my name or search Shatterproof, or go to the Shatterproof website, shatterproof.org, and you can reach me through there. In closing, I often think about the last time my son came home for a visit, 4 months before he died. We had a great weekend. That last night, the two of us were on the back porch talking about his favorite topic, the New York Giants. And then the conversation turned to his recovery. He looked at me with a tear in his eye. He said, "Dad, I wish that someday people would realize I'm not a bad person. I'm a good person with a bad disease. And Dad, I want you to know I am trying my absolute hardest." Well, for Brian, it's been too late, and millions of others, it's been too late. But for the next young woman, the next young man, the next family, let's drag addiction out of the shadows and into our hearts. I truly can't imagine a more perfect expression of humanity. Thank you so very, very much. Thank you.